Wednesday, which is May 1st, we were talking about how this month has flown by, but May is Stroke Awareness Month, and today we're joined by Brookwood Baptist interventional neurologist Dr. Sharma and his former patient Connie Wilcutt. And we were just talking about in the commercial break about stroke. We often talk about stroke and how to identify them, but people don't realize there are multiple types of strokes out there.
Oh yeah, that's true, Kelsey. Now with stroke, the May is Stroke Awareness Month, and we want to bring this awareness to the community. Stroke is, there are two types of stroke. One is a blood clot, that means lack of blood flow to the brain can cause stroke. And those patients will have acute onset of facial weakness, speech problems, and that's when we say call 911 and come to the hospital. Now, other types of strokes are brain bleeds. So patient will say they have worst headache of their life. They may have brain aneurysm that leaked. And in that case, it's more of an emergent situation, and we have to close off that aneurysm as soon as we can. And I have my patient with me that will talk about the brain aneurysm and leaks. Brookwood is one of the 5 hospitals where we can do this endovascular covering of the aneurysm. And I think Connie will help us to understand what happened that day.
And Connie, you were telling us in the commercial break what that day, a little bit over a year ago, felt like for you.
Right, it was really crazy. It was like all of a sudden just the worst headache of my life. And it continued on. I'm thinking it's some sort of migraine. But it got to a point where I literally was in the floor, you know, telling my family, I think my brain is exploding.
Wow.
And so they decided to call 911. You know, they said, where do you want to go? I said, Brookwood. I got really sick on the way, and so I guess when I got there, thank goodness, you know, the people in the ER knew exactly what to do. And the next thing I knew, I was having surgery.
Wow, like that day?
That day.
I think I came into the ER at night.
So the next, probably
It was early, yes. I sort of remember my mom telling me that she wasn't going to be able to get there before the surgery.
Wow, so
I remember talking to her on phone about your condition and saying that we'll take her to surgery this morning.
Exactly,
So it's been a year, you're feeling a whole lot better, but you're still obviously going for checkups, correct?
Yes.
Oh, yes. I think that'll be the rest of my life. Basically, they may get a little further apart, but yeah, I'm kind of a walking miracle thanks to this man.
It's all, as we say, God's blessing.
Exactly.
Now, as she said, I think she was at home, she was with her daughter. All of a sudden, she had a worst headache of her life. She also has history of high blood pressure.
Okay.
I do.
So, brain aneurysms, the risk factors are smoking, high blood pressure, family history of aneurysm. Then we worry about this aneurysms in the brain, and if they leak, they will complain of this worst headache of her life. And that's where we help them with the treatment right away. Go ahead.
I was just going to say, we don't have much time left over. I don't want to cut you guys off because I could talk to y'all forever. But we have a couple more seconds left. And you want to tell us about an event later on this month.
What we are doing at Brookwood is we have a stroke survivor event on May 20th in our women's classroom, our lunch time, 12 to 1. Please, all of you and from the community can come and learn about stroke symptoms, signs, meet with our paramedics and other stroke patients, and that will help you to learn more about stroke care.
Well, we thank you both so much for coming this afternoon. Connie, thanks for sharing your story. I hope people out there they recognize they may need to get themselves double checked, especially when it comes to stroke, because it can happen
When it comes to having just a headache that you can't even describe, go to the ER.
Go to the ER.
Absolutely.
Better safe than sorry.
Exactly.
Call 911 and come to the hospital. Time is brain.
It is. All right. Thank you guys so much.